Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Dona Cooper.
Notice we have some musician tonight. So it's Christmas. So I decided to do a show with a difference. This is our Christmas special. So on the show, I have some special guests, which you're going to meet very soon. So I just want to welcome you to Get Health with Dr. Cooper, a program designed to educate, inspire, and help you to live a happier, healthier life. And we know that music is relaxing. Music calms the soul. And we even use music in medicine. So that is why we're bringing you Christmas music today. So if you're a person of faith, sit and enjoy. And share and like. Share so others can join in to listen to this wonderful music. I have some very special guests. I have international guests and national guests on the program today. I have Mr. Duo from Montemorelos. He's a violinist. He's a teacher at the University of Montemorelos. And I have two young physicians. Actually, one is the medical student and one is the young physician. You know, the M's and the M's go together. Music and medicine. There are a lot of doctors who sing or play. And these two doctors here want to be in one currently. Well, as you notice, Dr. Lisa Brown, she plays the piano. And of course, Jeremy, he plays the violin, he plays the piano, and he does a lot of things. And you're going to be hearing from them right now. So I'm going to ask Mr. Duo to just play another song while we get ready for a program. ¿Se puede pasar a tocar cualquier himno de su programa? And then we're going to go right in the program with Dr. Lisa Brown and Jeremy Brown. Thank you. that was Mr. Duo Tadio from Montemorelos. Now he has some CDs, and then you're going to be, if you'd like one, just inbox me and I'll send you the information. All right, so welcome, Dr. Brown.
Thank you.
And Dr. Brown. Don't be shy. The next couple of years, you'll be Dr. Brown. Of course, you know, medical students never like to be called doctors, but actually, you have to get used to the doctor. You've worked hard for it. And Jeremy, I'm going to be picking on you first.
Okay.
Tell me a little bit about yourself. Where are you going to medical school?
I'm a second-year medical student at Baylor College of Medicine in Houston, Texas.
Right. And I know you had a tremendous first year. I've been following you on YouTube. All right, you have a channel there.
Yeah.
And I know you have done very well. Tell me, during your first year, what were you asked to do in addition to studying? Were you a teacher there? Were you a tutor?
Yes. So during my first year, I think the beginning segments of it were just very difficult, trying to adjust to how much they wanted us to study, the volume of information that they wanted us to absorb at such a quick rate. But once I sort of got the handle of that, I started to pick apart what I like to do, and an opportunity presented itself to be an anatomy tutor for the incoming first years. And I really love anatomy, and I've always had a passion for teaching since college, so the two really mesh together.
Very
quite
good.
nicely.
What do you think I brought you to this program? Not to discuss entire medical school. Do you think I brought you there? Jerry, you have been a model young man, and I know that you're going to be a successful doctor. But while I was planning this program, I was looking for doctors that play. I really wanted doctors or medical students to play on my show. You chickened out, but that's all right. You opted for the interview.
Yes.
And I tried to videotape your church yesterday so I could put that on, but I failed.
Oh.
So I know you did very well. You have done marvelous well. And, you know, this is a season where we give gifts, we say thanks, we think about Jesus Christ who came as a babe, lived an exemplary life, and then he's gone to come back. He was a servant. And there's one thing I admire about you. You're always willing to serve. A couple of months ago, I think you found yourself in Houston after the flood. Tell us a little bit about that.
Oh, so that was quite the experience. I'd never been in a disaster like that before, where entire communities are destroyed. The streets look like rivers. Boats are in the street. So I just knew when I saw that, right after the storm had passed in the morning, I knew I had to go and do something. So I took the next couple of days, an entire week actually, just to volunteer at various homeless shelters and help clean out whole communities and houses for people, help them relocate, and that was an amazing
Well, it's a
experience.
big heart, really.
Yes.
Medical student taking off a week to go serve the community? That's a little unheard of, because studying medicine is a challenge. But you have done very well, and I just want to commend you. Now, before I continue with you, Jeremy, I have a very special lady beside me here. And Dr. Lisa Brown, tell us about yourself. What is your area of emphasis? Where you're currently working?
Okay. So, hello. My name is Lisa Brown. I recently finished my fellowship in both geriatrics and palliative medicine in Texas, in San Antonio, Texas, and I recently moved to Maryland, Annapolis, Maryland. I'm working at a hospital called Anne Arundel Medical Center, and I'm actually practicing inpatient palliative medicine there. A lot of individuals don't know what palliative medicine is.
Yes.
So it's a growing field. It's essentially a field where we care for individuals with life-limiting illnesses, and we help them with various symptoms. So physical symptoms, we do a lot of pain management, nausea, vomiting, etc. Spiritual and emotional pain as well, those symptoms. And our main goal is just to make sure that individuals live the best quality of life possible for whatever period of time they have left.
So you're double board certified or triple?
I will be eventually triple board certified.
Wow.
So.
This young girl is
Wow.
triple. It's going to be triple board certified.
Yes.
Family medicine.
Family medicine,
What else?
palliative medicine boards,
All right.
and then geriatric medicine
Very
boards,
good.
yes.
And if you joined us at the beginning of the program, you realize that Lisa is very talented. She just played the piano. Lisa, apart from working with your patients, what else do you do? Do you have a church community, and are you very active there?
So I have found a church community. I'm working to become active in that church community. The church is a bit of a ways for me, but I enjoy it and I join the young people. So I'm working to, yes, get more involved in that community.
Very nice. Very nice. Now, this show is a show that is designed to discuss lifestyle medicine. It's a growing field. And most of our chronic diseases, now we are starting with lifestyle medicine as the number one treatment option. And then we add medicine to that. I'm going to ask Jeremy. You're in your second year of medicine. What do you think? How would you place lifestyle medicine in your future practice? It's a simple question.
Overall, I think I do agree with you about how lifestyle medicine is being brought to the forefront of our field as time progresses. We've kind of gotten ourselves stuck on the one cure all sort of mentality where, oh, I have a problem, let's see if I can just get some medication for it and solve it. But if we can get ahead of that and primarily treat the issues that would cause the disease, then that would save a lot of people a lot of pain, a lot of financial problems as well. And nobody likes to lose their health. So I think in future practice, it would probably be the first thing that I go to.
Right, getting to
when
the
discussing
root
that
cause
with my
and
patients.
solving that rather than just adding a band-aid to the problem, right?
Absolutely.
I think you're a smart, wise guy.
Ah,
I think we're going to take a break and we're going to go back into music with Mr. Tario from Montemorelos. beautiful. Thank you. Gracias. Háblanos acerca de usted tantito. ¿Dónde está trabajando ahorita?
Trabajando en Montemorelos, Universidad de
So I asked him where is he working. He's working in Montemorelos University. ¿Qué hace ahí usted?
Soy profesor de violín.
So I asked him what he does. He's a professor in violin.
Y estoy trabajando en la Orquesta Sinfónica de la Universidad Autónoma de Nuevo León en Monterrey.
And he works in the Symphonic Orchestra in Monterrey. ¿Usted tiene cuántos años tocando?
No más que 30 años.
I asked him how many years has he been playing? Over 30 years. Do you have this music on CD? ¿Tiene esos música en CD?
Sí, sí, tengo música navideña y tengo otro CD, mi tributo, donde son himnos cristianos.
So he has Christmas CD as well as just general Christian CDs. So if you have interest in listening to this wonderful and beautiful music, then please inbox me, send me a message, and I'll get you the CD. Los precios de los CDs.
De navideño, $10 y de mi tributo, $15.
So the Christmas CD is just $10, and the My Tribute CD, that's just $15. $25 for two beautiful CDs. I purchased these CDs last night. Wonderful. Gracias. So voy a sentar y luego se va a tocar otra vez. So he's going to sit, don't go away, share and like, because he's going to come right back and play. I'm going to go back to my special guest, Dr. Brown, Lisa Brown. She's board certified in family medicine as well as palliative medicine. And then Jeremy Brown is a second-year medical student at Baylor University School of Medicine. Lisa, palliative medicine.
Yes.
People will hear of family medicine, internal medicine, oncology.
Yeah.
Talk to us a little bit more about palliative medicine, why you recommend that if someone is sick and in their last stages of life, they probably should be in palliative care.
So yes, so palliative care, like I mentioned earlier, is a growing field for individuals with life-limiting illnesses. So we actually recommend that even if you're at the beginning of that life-limiting illness, that you get involved in palliative care. A lot of people are under the assumption that it's just hospice, but it's actually a lot more than that. And I feel as though and individuals in palliative medicine feel as though when you get on it at the end of your illness, you don't really get the full benefits. So if you have a life-limiting illness, cancer, COPD, congestive heart failure, COPD is chronic obstructive lung disease, any other illnesses that will limit your lifespan, we recommend that palliative care be involved. We have, medications that can help with your symptoms. For example, if you have chronic obstructive lung disease, you'll eventually become very short of breath. We have medications that can help with that. With cancer, individuals have their cancer spreads to different parts of their bodies. We can help with pain, with the nausea that comes with that. And then we provide supportive care for you and your loved ones throughout that period of time. And of course, if it comes time where, medical management cannot cure your illness, then of course it'll be hopefully an easier transition to end-of-life care or hospice. And because you've been involved at the beginning and throughout, the course of that illness, it's a bit of an easier transition. Never easy in general to recognize that, the end of your life is coming, but it helps that you've had the support and to help to realize that that's where you are.
A lot of my patients, when I mention palliative care or hospice, they think, oh, are you saying I'm dying right away? I don't want that. So I think we have to educate the community that this is something they need because it's supportive care. There are multiple team members to help the family members care for these patients who are that chronically ill. Am I right?
Yes, you're right. It's an interdisciplinary team. So we have physicians, we have nurse practitioners, social workers, chaplains. All of these individuals are part of the team and help to support the patient and their family.
Very nice. Let me take some time here to welcome some of my viewers. Brother Boxhill from New York, welcome. Please like and share. We have beautiful music for you. My cousin Pauline Hogg from England. Hi, Pauline. Welcome. Patricia Torres, my patient. Welcome. Miss Daniak, welcome. Please like and share. We have beautiful Christmas music for you. And I'm here with two lovely, lovely, lovely doctors and Dr. to be. I've watched these young people grow up. They're like my children. So I'm so happy to be sharing the stage with them tonight. Jeremy,
Yes.
you hear your sister talking about palliative care.
Mm.
What are you thinking about medicine? What area would you like to pursue after medical school?
Well, I start my clinical rotations this year, so things might change. But so far, my top two choices are going to be pediatrics or emergency medicine.
Nice,
Yeah,
nice.
those are what I'm interested in.
Pediatrics.
Yes.
Why pediatrics? I know Lisa wanted to do pediatrics.
Not
And over
anymore.
the time that is gone, that went away. So why peds?
Peds is a very interesting and can be a very fulfilling field, mainly because you're not just working with one patient, but you're working with the patient as well as the family. Children also have this amazing ability to bounce back from things. So they can get sick very, very quickly, but they can also recover very, very quickly. And that vitality is extremely interesting and extremely powerful. And when you're working in peds, you have the opportunity to not just shape somebody's life at that moment or for the time that you're treating them, but you give them the opportunity to have a full, long, and healthy life.
You know, Jeremy, I was speaking with my daughter, Donnell, because she's currently doing pediatric, but she just ended. And she told me the exact same thing. Mom, I'm thinking I want to do peds because I have the opportunity to touch the child's life and shape the life forever, in quotation mark. And also, I can also help the family. So you guys are on the same wavelength. I really admire that. All right. You know, I have been practicing medicine for 27 years, internal medicine, but I do like working with the family. As a matter of fact, I also see patients at home. When I go to their homes, then I am in their intimate space that I can touch their life in a very different way. I remember one Saturday, rather than going to church, I went to several patients' home just to minister to them. And that brought me so much satisfaction. You see, when you're in medicine, you have the opportunity not only to touch the physical life, the physical aspect of the person, but the spiritual, the mental. And as you continue in your path, Lisa, and as you start, Jeremy, we have to think of seeing medicine in a holistic approach. You know, many doctors spend time thinking about the physical. Okay, so you're here for cough and fever. I think you have bronchitis or pneumonia. I'm going to treat that. But sometimes you have to listen to the patient, listen beyond the symptoms, and get to the actual cause. Is that patient depressed? What's going on? Is that patient eating healthy? Is that patient exercising? How is the immune status? How is the home situation? When you touch the patient's life in that holistic approach, then I think you're having a more lasting impact on changing lives.
Absolutely.
All right. So Lisa, tell me what your day is like, a day in the life of Dr. Lisa Brown.
A day in the life of Dr. Lisa Brown. Well, I wake up, get ready for work, maybe wake up around 6 o'clock, leave the house around 6:45, get to work at 7. I have 4 nurse practitioners that work with me, so I make the list, I print out the list, and I assign who is seeing which patient. And then I basically prep my patients, so whoever I'm seeing, I look through, their chart, see what their temperature and their vitals were overnight, what their pain level was, how much pain medication they used over the past 24 hours, if there were any changes that were noted by the nurses or what other consultants might have written in their notes. Then I go and see the patients. That usually takes the majority of my morning.
Do you see them in the hospital?
In the hospital, yes. I'm in the hospital setting.
Oh, okay.
And then we get consults in from, the primary physicians. And so when we get those consults, I divvy them up to individuals. And then, of course, I'll do I get patients as well. And so I see those patients. And so it's kind of just seeing the old patients, seeing the new patients.
Okay.
Yes.
So you're kind of new at the job.
Yes.
Tell me, when you started that job, did you have any difficulty? What was the transition like?
The transition was a bit difficult. I had just come out of training, a couple months prior. I was supposed to have a mentor that was to help me, to guide me in that process because I'm also in a leadership position, and she was kind of to help me in that position. And so when I got there, I was under the assumption that she was just on vacation for a few weeks, but it turns out that she is ill. And she's supposed to come back every month. It wasn't coming back next month and the next month, and it just kept getting pushed back. And now it's January.
Oh, so and she's not back?
No, she's not back.
So you had to kind of figure your way
out?
Yes,
so I had to figure my way out, talk to different individuals. The team members didn't know that I was supposed to be the leader of the team, and so that caused some friction as well.
Oh, my Lord. How did they see you as a young grad? You look very young. I know you are young. Did you have a problem there?
I don't know if that's what it was, or maybe they didn't think that they should be taking direction from someone who looks so young and who was just out of training. But we've, things have smoothed out at this point in time, I think.
And you're enjoying yourself.
Yes, for the most part. Yes.
Good job. Let me take some time to welcome some people here. Jennifer Lynch, I don't know where you're watching us from. Welcome. Marjorie Smith, welcome. Mr. Gordon from Jamaica. Welcome from Jamaica. All right, Harry, welcome. Zelda. I see your aunt here, Paula Chang.
Oh.
Guys, say hi to Paula.
Hi, Paula.
Ralph Flores, thank you. Please like and share. I have two amazing young doctors here. Hi, Leroy from England, my cousin. Sharon, welcome. We are just talking here easily with two young doctors. Dr. Lisa Brown, she works, what's the name of your hospital?
Anne Arundel Medical Center in Annapolis, Maryland.
Right. And then Jeremy is a second-year medical student at?
Baylor College of Medicine in Houston, Texas.
Very nice. We are going to listen to another song from Mr. Duo. The people here are enjoying your music. Están gozando de la música, así que vamos a seguir, okay? So we're going to take a break while we listen to another special from Mr. Duo. my viewers that if you want, if you would like one of the CDs, then inbox me and I'll get the message to Mr. Duo. He has a Christmas CD for $10 and then my tribute CD for $15. So 2 CDs, $25. All right? So I want to welcome all of my viewers that are watching me from wherever you're watching from. I just realized that Zelda Malcolm was my high school classmate. Zelda, if you're still listening, welcome. I wish you a Merry Christmas and that God will grant you good health. Remember that Get Health with Dr. Cooper is a program designed to educate, inspire, and empower you to make simple lifestyle changes and therefore change your healthcare destiny. Today, the program is a special Christmas program, so we're not going into details about nutrition and exercise or anything like this. I'm interviewing 2 young, promising physicians. One is already done, Dr. Lisa Brown and Jeremy Brown. Now, you might be wondering, Brown and Brown, are they brothers and sisters? Yes. Now, you might be wondering, so 2 doctors in the family? Is there a 3rd doctor in your family or a third, fourth? Talk to me about who inspired you to do medicine. Jerry, you could start.
Okay. So yes, there are 2 other doctors in the family. So one is father is a doctor of chemistry. Mother is a doctor in family medicine.
Internal medicine.
Internal medicine, excuse me. And I think just seeing their work ethic and how they live their lives and how they treated people, especially their patients or their students, really inspired me to just go for excellence from the beginning and aspire to be great at whatever I put my mind to. And this was just the career path that I felt would fit not only my characteristics but the way I wanted to help people as well.
Nice, Jerry, nice. I'm going to take a break to welcome some people here. Jennifer Lynch, you're watching from Florida, welcome. Donna O'Connor, you're watching from the Cayman Islands. Give my love to Capel and all the family there. Welcome, Dr. Bose. Thank you. I know your daughter did pediatrics, so maybe one day I'll have her on the show. We can talk a little bit. So thank you for watching, Dr. Bose. And to Paula, say hi.
Hi, Paula.
And Pauline, thank you so much. Donnell, thank you. She's saying you young guests are very inspiring.
Oh, thank you, Donna.
Thank you, Donna.
So guys, I want to thank you so much. So Dr. Lisa Brown,
Yes.
tell me, why are you in medicine? Who inspired you? Your role model.
Yes. I guess I would have to say my mother. She actually didn't want me to go into medicine. She asked me a few times, are you sure you really want to do this?
Okay, Donnell, did you hear what Lisa said? I've asked you the same thing and you think I'm discouraging you, but it's a tough road. Go ahead, Lisa.
It's a tough road, exactly. But she really has been my role model. She's someone that I aspire to be in just my daily, even though we're doing 2 different things. But just her work ethic and the way that she treats her patients, it's what I aspire to be in the way that I try to treat my patients. I think because we grew up in a medical household, perhaps that's what we've been surrounded with. We always hear stories. And so I honestly couldn't imagine myself being anything else. And she just kind of fastened that in my mind. But I also see medicine kind of like a puzzle. You have different pieces of the puzzle and you just kind of put them together.
Right.
So that's another reason why I love medicine. But definitely my mom, she's my role model, and I definitely aspire to be just like her.
You
when
have
I
a
grow
wonderful mother.
Yes.
She's like my sister. She was on my show a couple of weeks
Yes.
ago. She did a fabulous job.
Yeah.
She came with her hair nicely done.
Oh.
We were trying to mic her, and she said, please don't touch my hair.
Sounds like
I
it.
said, okay, we're not going to touch your hair. So, yes, Dr. Marlene Chang Brown is a wonderful doctor. She's very loved in the community. As a matter of fact, I think her office gets the best in customer service almost every year.
Oh, wow.
So she's doing a fantastic job. So you guys have a wonderful, and of course your daddy, your father is a great man, a man of faith. Studies have shown that patients who have a faith community tend to live 7 to 10 years longer than someone who does not have a faith community. So even though he is a doctor of chemistry and he's in the church, running, taking care of the church, is the pastor of the church, He's also ministering to our spiritual needs or psychological needs, and that's also important when we talk about holistic approach to medicine. So if you guys want to learn more about the Browns, inbox me. I'm actually about to inbox me. All right, guys, let me see who else. Remember, this is Christmas. We need to have fun. We're celebrating the birth of Christ. Came a long time ago. We really don't believe he came on December 25th, but the fact that he came, and that is what we're celebrating. So, hi, Zelda. Yes, yes. Good night. So, like and share the page. We still have at least one more music. Una más, no? Después. We still have more music. So, like and share. Enjoy the season. I want you to live healthy, and you must be healthy mentally in order to be healthy physically. Because health is not only the absence of physical ailments, but also the social and emotional well-being. So music, a couple of years ago, I did voice lessons. And whenever I was in class, I would be so relaxed, blood pressure would go down, I would be doing so well. That was my therapy. Then my voice teacher left the valley, and I have no more therapist. So enjoy the music tonight. And if you're going to be on the replay, listen to the entire program because we have some really wonderful music. All right, Jeremy,
Yes.
what instruments do you play?
Piano, violin, and saxophone.
Wow, where do you find time to play all those?
I think a lot of it. I started piano at a first very young age, maybe around 5 years old, and then started playing clarinet initially, and was in the band at my middle school, and transitioned to saxophone from that, and then after I got pretty good at saxophone, I decided that I wanted to try and play violin. So,
All right, so you,
yeah,
you
it was
play
just-
just about everything almost. Multiple instruments. You're a guy of many talents. You have a YouTube channel, and I have listened to that channel. Very inspiring. Talk to us a little bit. Why did you start
so-
the channel, and what is it all about?
Okay, so the channel is called JB to MD, and
What does JB mean?
JB is Jeremy Brown,
Oh,
so
okay.
that's my name.
Okay.
Yeah, JB to MD, and I think I just wanted to document my life. Originally, just going through school, but then I realized that I had a platform, or I kind of created a platform for myself to reach a lot of other people that were kind of wanting to know what sort of experiences I was going through, as well as um, hearing about experiences that maybe aren't talked about as much by other people that sort of have similar genre type channels. So I felt like that was a good way to not only um, record what was going on in my life, but inspire others to shoot for excellence and pursue further education as well.
Very good, very good. If I'm sure that there are multiple young people that will be watching the show. If someone wants to do medicine, but they're hesitant, or they're not getting good grades, or they're just having difficulties, how would you counsel? What word do you give to that person that might be watching?
It's very difficult, especially because the people that want to go into medicine are going to be a very specific type of people. Most of us are going to be type A personalities. We don't like failure, and we don't like feeling like we're not doing well, and we don't like feeling like things are so difficult that we can't handle them. So I think initially, whenever I come across something that I'm having a very hard time with, I sit myself down and I calm myself and I say, okay, let's just focus on this one problem. Let's not look at the big picture, but let's just focus on this one thing at a time. Taking one step at a time has helped a lot, and looking at things here and there that I can improve in myself has been a big thing too. Also, just asking for help.
That's right.
Sometimes it's very easy to be proud and to say, I can figure it out, I can do this, I can do that. But just going to people that are more experienced than you, people that have gone through the same process themselves, and learning what they did to achieve their success is a huge benefit.
That's right. So I'm hearing you say, break up your challenges into
Mhm.
small bites and take these bites at a time and focus.
Yes,
And don't hesitate to ask for help
absolutely.
because, life is a challenge. But if you focus and if you really change your thought process, then you can do it. I have a lot of patients who are overweight, patients who have diabetes, but it's so hard to control their disease process. Why? Because they're not mentally ready. They haven't changed their mindset.
Hmm.
So, in order to succeed in just about anything, the change must begin here.
Absolutely.
You need to think it. And if you
Mhm.
think it, then you probably put it into action and you can succeed.
Mhm.
Lisa, a young doctor just starting your profession. Um, do you have any advice for residents, young medical students, or doctors who are not at your level yet?
Just take things day by day. I think the same thing that Jerry said, you can't look too far into the future. You get very overwhelmed. It's a lot of pressure. And I was just telling Jerry the other day, I mean, med school, residency, and getting to your actual job, they're all difficult. They're just different levels of difficulty. Med school is just getting through that wave of information. Residency is learning how to become a leader and to delegate and to, manage patients. And then when you get to your actual job, it's learning how to work with your coworkers and not having anyone to rely on. It's just you in regards to, making decisions, right? So I would just say take things day by day, ask for help, talk to individuals who have gone through this before. I have individuals currently at work who I go to and I speak with when I feel really frustrated that help me as well, and praying as well, and having something that can take your mind off of things. I think it's important to have an outlet, because if all you do is study your work and you don't have any way to relieve yourself, like Donna said, her singing, then you can get really bogged down and overwhelmed. So just making sure that you have an outlet where you can kind of relax for a bit as well, I think is very important.
You have to disconnect.
Yes.
Turn it off when you get home.
Right.
I always discuss with my children the lifestyle of a successful person. What would you say? Give me some of the pearls of what a successful lifestyle should be. It could be simple. What's the lifestyle of a successful person?
I always have a plan for the day. Before I go to
Good.
bed, I'm going to wake up at this time in the morning, even if I'm on my day off. I say I'm going to wake up at this time. I'm going to spend this much time at the gym. I'm going to spend this much time, doing this. I'm going to make these things at this time. I'm going to meal prep for the week. I just have a plan for the entire day, and set my time accordingly. I try not to waste time if I can. Of course, if I have time to relax, I do so, but I also make sure that I'm also doing things within that period of time. So for me, it's always having a schedule and knowing exactly what I'm going to do.
So I hear the key word plan, schedule.
Yes.
Right? Because someone said, he who does not plan, plans are ready to fail.
Right.
So you must have a plan. All right, Jerry, give me what your take on the lifestyle of a successful person.
Um, First off, yes, I do believe that having a plan is probably one of the best things you can do. But also, I think success is not something that happens overnight.
Right.
Success is something that is garnered and cultivated over time. And sometimes in long processes, it's easy for us to forget why we started and forget kind of what we're doing and where we are in that sort of path to success.
Right.
And that's where you kind of fall into the pitfall of, oh, am I really getting anywhere? Am I really improving? Am I really getting better? And then the progress stops. So I think having some sort of reminder for yourself alongside your plan for each day for why you're doing the things you're doing in that day is a big difference maker in pushing you towards
You guys
success.
are smart. So a plan, a schedule, and remember that success is not a sprint. It's a marathon. So you're going to be falling and failing, but the important thing is to get yourself up and keep going to the finish line. Guys, it has been a pleasure. We're not done yet, but I'm going to ask El Señor para regresar. Usted tiene uno más, ¿no? So we're going to take a break. We're going to listen again to Mr. Dio from Montemorelos as he plays the last song. Please like and share. And if you're watching us on the replay, Just like and share as well. And Merry Christmas to all of you. Happy holidays. We're not done, so don't go away, just share. We're going to listen to some more music. Muchas gracias. Thank you so much. Remember, everyone, that if you want to obtain these music, then please inbox me. There are two CDs. There's a Christmas CD for $10, and then there is another CD for $15. All the money goes to him. I'm just here assisting, alrighty? So if you want to hear beautiful music, and I do believe that music is therapeutic, then inbox me and get this music at home. Now, as we think about the Christmas season, I want you to just remember that it is really better to give than to receive. And that's what the Bible says. If you watch my show, you realize that I'm a woman of faith, I'm a doctor of faith. So remember to give love, give your care, give understanding. There's sometimes you have people who just want someone to listen to. Just be sensitive to know when to listen. And remember that Christ came as a babe. Christ died for us all. And he wants us to follow him by loving our brothers and our sisters. I am going to close now. However, I would like to hear some final words from these wonderful doctors. I'm going to call Jerry a doctor. You better claim it, okay?
Okay.
I know you have 2 more years, but claim it.
Okay.
Anything
Try my
else you
best.
want to say?
I think the only thing I'd want to say is that most good things in life are not going to come by easily, and they're going to be hard to obtain, hard to learn. But at the end of it, at the end of all the hardship, at the end of all the struggling to try and understand or to learn or to gain something from whatever you're going for, there's this feeling of satisfaction. And just knowing that you went through that struggle makes you into a stronger person. So I would encourage all those that if you feel like you're going through some sort of struggle at this point in time, think of it as gold going through the fire. When gold goes into the fire, it's black and it's dirty and it's raw. But when it comes out, it's pure and it's something that everybody admires. So that
All
would be
right.
my
And
final
Lisa?
point.
Right. I would just say, just work hard. If you have something that you're striving for, just go for it. Have always been of the mindset that I don't want to look back and regret that I didn't work hard, or I could have done this or I didn't do that. Some things take a while to achieve, and it is a long road, like Jerry said. But just keep looking at the end game and just do your best. Don't look at what anyone else is doing. Just focus on what it is that you want to do and what you want to achieve. And if you do that and you work hard, you can achieve whatever you set your heart to. So just keep looking at the finish line, and eventually, even though it's a long journey, you will make it there.
Right. And we can apply that to health. I know there are a lot of people watching here who are patients who might have a chronic disease, diabetes, hypertension, heart disease, whatever it is. You might have set healthcare goals for 2018. And as we come to the close of the year, you probably think you're a failure. But remember, you're not a failure. You need to just continue to move forward. Remember, as Jeremy said, that success is not something you sometimes grab immediately. It might take a while. So keep pushing on. Remember that the most important disease modifying factor is nutrition, what you actually consume on a daily basis. So I'm going to go back to saying that you should think on changing the way you eat. Move to a more plant-based whole food diet. Decrease your intake of animal products, fats, sugar, processed foods. Exercise is medicine. Meditate. The lifestyle of a successful person. I will give you my points. And when I say successful, it could mean financial success, personal success, or health. You make a plan. You start your day off with meditation. And I always think early to bed and early to rise can produce general health, a holistic approach to health. So go to bed early before 10. After 10 o'clock, between 10 and 12, that's where your metabolic hormones levels are rising. And you need that sleep, those 2 hours prior to midnight, to help the body regenerate. Go to bed early, then wake up early, meditate, exercise, plan your day, and try and achieve the day. At the end of the day, look back on your schedule and see, what have I missed? What did I not do? And try to do that tomorrow. And remember that when you're ending your day, you should be grateful. Whatever unhealthy experience you might have had, unhappy experiences, then try to forgive. Because if you don't forgive, then you can create chronic diseases in your life. High blood pressure, diabetes, heart disease, just by having the excess negative hormones that are adrenaline and cortisol. So I'd like you to forgive and love. As we close the program, I'm going to go back to the song we started with. I'm going to ask my special guest to go back and play. Vamos a tocar otra vez esta canción as we close out. So let's go back. And I want to thank you all for watching me. Please like and share the page. My cousin, Paul, thank you for joining. We're going to close out with this song. And if you guys, to the audience, know the song, let us sing. Okay. watching. I'll see you next week. Bye-bye.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website www.cooperwellnesscenter.com.